Okay, so why reviewing sitting up in bed? Okay, it's because of all the recorded incidents of pressure ulcer over a bony prominence. The sacral area and the heels have the highest incidence. And sitting up a person up in bed will generate high shear and high pressure. So what I want to review today is how to sit a person up and how to minimize the buildup of pressure and shearing at the sacral area and high pressure at the heels. So the first step is to move the person up on the bed. So what we're trying to do is to match the person bending point, okay, flexing of the hip with the bending point of the bed. So to best match them is to move the person up on the bed so that the sacral area is positioned higher than the bending point of the bed. Okay, if the person is positioned too low on the bed, as you raise the head of the bed, if the bending point of hip and bed are not matching, the person will be flexing from their spine instead of flexing their hip to sit up. Sitting with the trunk flex forward is very uncomfortable, but not only is it uncomfortable, it will make breathing very difficult. The ability to take a deep breath will impede digestion and can cause gastric reflux. The second step is to raise the foot of the bed. By raising the foot of the bed, this will effectively stop the person from sliding down on the bed. Also will transfer some of the high pressure, the pressure buildup at the sacral area, to the back of the thighs. Also, raising the foot of the bed will move the heels further off the surface. Okay? So effective to decrease pressure over the heels. If heel pressure sore is a concern, the risk for heel pressure sore is a concern, you can also add a pillow or a heels up under the leg to completely offload the heels. If you leave the foot of the bed flat, okay, and then when you raise the head of the bed, the person will be sitting with a straight leg position. Okay, so sitting up with a straight leg position will result in the hamstring pulling on the knees towards the knees into flexion, which will result in the heels being pressed hard against the mattress surface. Okay, so the next step is to raise the head of the bed. So as you raise the head of the bed, the tendency for the trunk is to extend, to travel up on the mattress surface. For a mobile person, as the head of the bed raises, the person will adjust, will shift to extend their trunk to maintain comfort. If the person is immobile, the trunk is trapped in the mattress surface. And as the head of the bed is rising, the trunk will collapse into flexion. The person is unable to adjust their position and to free up their trunk from the mattress. So this will push the pelvis into the mattress, building up pressure and shear at the sacral area. Also, for many, this is a very uncomfortable position, resulting again in pain in their back, and also the spine flex forward will compromise the ability to take a deep breath. So what we will demonstrate is the trunk release maneuver, and that's to free up the trunk from the mattress surface and allowing it to extend. So this method was developed by the musculoskeletal injury prevention team. So it's a two-person trunk release. So you put your outside leg forward and the inside leg back. You hold on to the repositioning sling and then you shift your weight from front to back, pulling the person's trunk forward, but just enough to clear the mattress surface. Okay, and to sit them back. So you're freeing them up from the mattress, allowing the trunk to extend, decreasing the pressure at the sacral area. And it is to note that the pelvis is not lifted off the bed. If while raising the head of the bed, the person wants you to stop raising the head of the bed, there might be a lot of pressure build up in their trunk. So it's possible to stop raising the head of the bed, do the trunk release, and then try to continue raising the head of the bed. Okay, so the trunk release, outside leg forward, inside leg back, and we shift our weight from front to back to pull the trunk off the mattress surface and then sit the person back. So in conclusion, sitting up in bed is always associated with shear and pressure buildup at the sacral area. So these 4 steps are necessary to minimize the buildup of pressure and shear. First step is to move the person up on the mattress surface. So to match the person, this is to match the person's bending point, flexing at the hips, with the bending point of the bed. The second step is to raise the foot of the bed. This is to stop the person from sliding down on the bed, but also to transfer the weight from the sacral area to the back of the thighs, and to raise the feet off the bed to decrease pressure at the heels. The third step is to raise the head of the bed. For an immobile person, as the head of the bed is rising, the trunk is trapped against the mattress surface, will not travel up on the bed, which will also drive the pelvis into the mattress surface, building up pressure and shear at the sacral area. Therefore, we need a 4th step, which is the trunk release. The trunk release is to bring the person's trunk forward, just to clear the mattress surface to allow it to extend, which will decrease pressure and shearing at the sacrum. It is to note, though, that these 4 steps, although they will decrease some of the pressure buildup and shearing, do not replace providing the person with an appropriate support surface that will address their needs for pressure management. And best practice of all, avoid sitting up in bed. Sitting up in bed is always a high-risk activity. Okay, sitting up in bed always results in pressure and shear buildup at the sacral area. If you're interested to find more about the research for these recommendations, here are the references.